The following is an encore presentation of a pre-recorded program. To join one of our many live presentations, please visit cje.net/events, call 773-508-1000, or follow us on your favorite social media platform.
Hello, thank you, Margaret. Thank you so much for having me today. It's an honor to be here today. My name is Borna Bonakdarpour. I'm a behavioral neurologist at Northwestern Mesolam Center for Cognitive Neurology and Alzheimer's Disease. And my research is focused on both, disorders and understanding physiology of language and music and music interventions. I direct the Functional Neuroimaging Lab and Northwestern Music and Medicine program. So today I wanted to talk to you a little bit about music, brain, and dementia. Before I start, I need to tell you about my disclosure. I have many conflicts. None of them are really of interest. The funding for the research I'm presenting today came from philanthropic contributions through Institute for Therapy Through the Arts and Northwestern Medicine, and also a grant we got from National Endowment for the Arts. And I made it simple. So we'll talk about three major topics today. I'll talk to you a little bit about music and the brain, how music is being processed in the brain, how we can use music as a therapeutic intervention, and specifically for cognitive disorders or dementias, how can we use music? I'll share with you some results from our ongoing research with Institute for Therapy Through the Arts called Musical Bridges to Memory. And then also talk a little bit about choice of music and then what type of music we try to use for these interventions. All right, let's get started with the music and the brain. So as any other sound, musical notes get in our ears through the external ear and then make their way to the internal ear, where you have the snail shell-like organ, the cochlea, where then the waves in the air will be transformed to electrical activity. And then with the auditory nerve, the eighth nerve, as you see here, the information gets into the brainstem. That would be the tail part of the brain in the bottom, as you see. And then there are many stops on the way where the sound gets processed before even it gets to consciousness, it gets to the auditory cortex. And then even at this lower level, processing, a lot happens in the brain. And then finally, the signal gets to the auditory cortex and the temporal lobes on the right side and the left side, bilaterally on both sides. And from there, we have all sorts of things happening to the signal. One of the first locations very close to the auditory cortex, as you see, is the insula there. And insula is very important in controlling our basic reactions and basic functions in the body. For example, breathing, heart rate, and blood pressure, they are very closely monitored through insula. And then there's this back and forth conversation between insula and the brainstem. And all these nuclei, or the stations that you see in yellow, blue, and green. And then from there, even before we get to the conscious, listening or hearing, there is an effect on our breathing, our heart rate, and our blood pressure. So I'll show you some examples of how this is important. And then from there, from the auditory cortex, as you see here, the information is processed more in more detail. That is, we will try to figure out if what pitch we are listening to what the relationship between these pitches are, the musical intervals, the quality of the sound, the timbre, the harmony, the relationship between the notes. So all of these are happening what we call downstream. You would think this downstream would be very close to the auditory cortex and the temporal lobe, but research by Zatori and colleagues have shown that actually the information goes all the way to the parietal lobe, as you see here, a place called intraparietal sulcus. And then from there, it goes to the rest of the brain. Intraparietal sulcus is what we call an association cortex. And then here, auditory information and then the musical information is integrated into many senses. So from here, it can go into the language system, into the executive system, into the spatial, visual system, emotions, which is the biggest probably effect of the music. So as you see the auditory signal now from a tone gets transferred to all parts of the brain. And from there, we have different feelings. We have a drive to move and all sorts of cognitive processes that come after we listen to a melody, for example. One of the major areas are the nucleus accumbens and ventral striatum. These are areas of the brain that are related to emotion and reward system. This was a very interesting study, Blood and Zatori, 2001, almost 20 years ago now. They asked people to pick a music that they like, and they like to the degree that it gives them goosebumps. So very effective music for the participants. And then they showed that compared to a music that didn't give them that much emotional arousal, they found a signal in nucleus accumbens and ventral striatum, which are areas that we use for reward and then emotional processing happens there. And then from there, so this is one pathway after tones make their way to the brain. Other pathways are to the motor system. That's how we have the urge to move or to dance, or it goes to the visual spatial system. We all have an imagery. We have things that we see when we listen to the music, automatically. There are memories that are maybe aroused from listening to the music. So from there, music finds its way to everywhere in the brain. So we need to have a course on music processing, but we don't have the time. So I think what I really wanted you to know is music perception is it's not only about auditory system. It's about connecting sound and processing of the sound to other things that brain does, such as moving, planning, remembering, imagining, speaking, and feeling. And then the important part is music engages regions of the brain that are involved in processing of mood and emotions. And then that's one of the major areas that I talk about today. All right, so so let's talk about a little bit about music as a therapeutic intervention. Music was used around World War II, right after World War II, as a method for rehabilitation. After World War II, there were so many people who experienced psychological or physical trauma, and then music was used for rehabilitation of either if they had traumatic events, if they had difficulty with walking or moving. So clinically, it has been really, integrated into medicine since then. Historically, music interventions, you can even find evidence for music interventions in Bible. We know that David played harp for King Saul to calm him down. And so this And then you can see it in the literature, in the Greek literature, thousands of years ago. So this is not anything that we didn't know. Same thing for arts. The story of Scheherazade and then telling stories to the psychotic king to calm him down. So the usage of arts as a therapeutic intervention has been known for a while. However, the research has been lagging, and then a part of it is just auditory research has been lagging because everybody is more interested in visual. It's like, out of sight, out of mind. So auditory research, including music, has been always lagging for that reason, because our brain is dominated by visual signals from our world. However, we can't ignore the fact that, auditory specifically in rehabilitation purposes. This is a paper that came out in Journal of American Medical Association this year 2000, about the time that I was writing my thesis on music interventions in stroke. And it was very promising at the time. I think probably the first time that JAMA, which is a very prestigious medical journal, talks about music therapists and the fact that they are now adding research to validate their interventions. In the paper, you see that there are 8,000 music therapists in the United States, and this is a huge amount compared to 1,800 in Germany and 500 in UK at the time. So we have so many trained music therapists in our country here that can be used for different medical issues, including neurological diseases and then psychiatric diseases. You can see neurologic.
Excuse me, Dr.
Yes.
We've actually lost your slides. They're not showing anymore.
Did you? I'm sorry.
Yes.
Okay, let me see what happened. Okay, I kind of saw that there was something missing. Let me actually share this other slide. Okay. Can you see my slides now?
Yes, now they're back.
Okay, so let me. All right, so yes, this was where I left off, I think.
And just so you know, if you're in the slide view mode versus the presenter.
Yeah, I think the problem is if I try to make it. Okay, so now it looks like it's in the.
Now, oh yeah, sorry, we're in like the actual presenter and we see your notes to it.
So yeah. I'm gonna have to do this again. Okay, let's see if it works now.
Success.
Okay, yes, I have no idea what happened. Sorry about that.
No worries.
That's what's been dealing with for the past year and a half. I hope that we can do this in person soon. Okay. Anyway, so this was a great outlook at the time. And then, fast forward, interest even grew more in 2017. NIH, in collaboration with Kennedy Center, and then in the picture on the left side, you see Dr. Francis Collins, the head of National Institute for Health, with Renee Fleming, the world-known American soprano. they started this initiative to encourage the biomedical researchers, music and art therapists, and neuroscientists to work together towards three goals: increasing understanding of brain processes of music, developing a scientifically based strategies to enhance normal brain development and function, and advance evidence-based music interventions for brain diseases and human health overall. So this created a huge momentum in the field. Before that, it was so difficult to find funding for music interventions. Most of our funding, as you noticed, actually came from philanthropy. So now the NIH made millions of dollars available for research, which created a lot of encouragement. And following that, we had the first music therapy conference at Northwestern University. And this was thanks to the effort of Dr. To the faculty members in the Department of Audiology, Dr. Nina Kraus, and all the experts that she invited from all around the country. And many areas were discussed during the conference, and then this was an inspiration for the work that we did later, and I'm going to talk to you about them. All right, so now let's switch gears to talk about music and dementia. This was another very interesting paper that came out in 2017 by Sivonen and Sarkamo, Finnish researchers, and they looked at the evidence behind a lot of different interventions for neurological disease. And they actually, so this is about 17 years after that JAMA paper came out. And then you'll see in the paper that a lot of clinical trials were reviewed. They were very promising, including for Parkinson's disease, for dementia, for aphasia, for epilepsy, and different neurologic disorders. And then one was, of course, dementia. About 17 studies were reviewed, and then they showed the efficacy of music for different areas of cognition. And so before I get into those research studies and then tell you more about dementia and music, I just thought I'd talk a little bit about Alzheimer's disease, which is the most common cause of dementia. And it's an age-related disease in about 99% of patients. In less than 1% of patients, it is genetically determined, heavily genetically determined, and familial. And what happens in Alzheimer's disease, you see a picture of the brain on the left side of the left hemisphere. On the right side, you see how the Alzheimer's disease brain looks like. You see a lot of shrinking in the brain, a lot of atrophy. And as you see on the right side, the top picture, the pathology in blue starts from the entorhinal cortex and hippocampus, the memory areas of the brain. And then from there, it gets to other areas of the brain, including the frontal lobe and the occipital lobe, and then the parietal lobe. But if you see in the bottom picture, there are areas of the brain that are not affected by the pathology. And those are areas that are somehow related to memory, executive function, and primary sensory areas of the brain. So that creates an opportunity for rehabilitation. The idea, the philosophy of rehabilitation is to use areas that are stronger and have preserved function to compensate for areas that have been damaged. So this is an interesting notion. Clinically, or what we see in the clinic, people start the pathology to have the pathology for about 20 years before the disease starts. And then the disease starts with some changes in memory in most of the cases, and in some cases in language, visual processing, and executive function. We call it mild cognitive impairment or mild neurocognitive disorder when the person is still able to compensate and still independent in activities of daily living. If the activities of daily living start getting affected by the disease, you'll have mild dementia. And then as the disease progresses, it goes beyond the memory and executive function, planning things, sequential events, getting things done at home, driving, taking care of finances, those get affected. And in moderate stage, even more, the person may not be able to independently shop or cook or use devices. And then in severe stages, you have trouble with gait, with incontinence, and the disease can get so progressed that it can affect breathing and then swallowing and cause pneumonia, swallowing problems, and unfortunately, people may die from the disease. When we are talking about music, the question is, where can we use music in all these processes? Well, the one thing that everybody talks about, and we still need more information about, is how about even before all this happens? We know that people who have higher level of education by age 18 do better later. They can compensate better, even in the presence of pathology in the brain. There is some evidence that music education can also do the same thing. We need more research in this area. In mild cognitive impairment through moderate, we can very easily use it. In severe stage, even we can use music. The cerebellum, which is a big part in processing of music, and I didn't quite talk about it, that is another part that processes coordination, rhythm, tempi, and then that is really intact until the very last stages of Alzheimer's disease. So that's why I'll show you some examples that people with Alzheimer, they can still respond to musical stimuli. And music is used very much for hospice care and for end-of-life care of dementias and many other diseases. Now, let me tell you a little bit about what those 17 studies that were reviewed showed. The effect of on cognition, meaning, can music help with memory or executive function? The answer is yes, but we still need more research in this area. It looked like it's not as effective compared to the emotional effects of music. There's a lot of research in the literature that focuses on the emotional effects of music in dementia. As later in the process of Alzheimer's disease, we have anxiety, there is hallucinations, delusions, there's also apathy, lack of response, lack of initiation of movements and thoughts. And music can help with a lot of these neuropsychiatric symptoms. With memory or executive function, we still need more research in that area. And then what I'm focusing on today is most of the neuropsychiatric symptoms. And then from very beginning, we see anxiety because of the devastating aspect of the disease. A lot of patients have anxiety. Can we use music to calm individuals with dementia and anxiety? And then as the disease gets worse, there's a huge amount of caregiver burden on spouses and the family. And can music help both the patient and the caregiver? There is some evidence that that's true. And then in general, all studies showed improved quality of life and decreased depression and anxiety. So, and then why so? I mentioned some of the reasons. So these are additional reasons why music can help in dementia. First of all, music is processed via a distributed network. As I showed you, it's not just the auditory cortex. The processing of music goes beyond the auditory cortex to other areas of the brain to affect other modalities of cognition. The other reason is prolonged availability of musical memories. And this is a very interesting phenomenon where people, first, what disappears in the brain is the auditory memories. I'm sorry, is the visual memories and verbal memories. And the auditory memories stay intact for a long time. So we can use that as a way to really interact and communicate with patients with dementia, especially in the later stages. And music also provides an alternative way of emotional engagement and expression. For example, someone who's in moderate to severe stages of dementia, they may not be able to communicate very well, either because the language system has been impacted or because the executive function and attention is so poor that doesn't allow people to communicate verbally. But still with music, this might be possible. And then music can be used as a regulator, as a mood regulator in these cases. This is an example of a very lovely friend and patient of mine. And you'll see this is more towards the severe stage of the disease. And I hope you can hear how he can very well whistle with the music. You may have to turn up your volume. The volume is a little bit down on this one. Couldn't be more perfect. And then this is another example from a documentary you may have seen, Alive Inside, that shows how impactful music can be in someone with moderate to severe degree of dementia.
See Henry inert, maybe depressed, unresponsive, and almost unalive.
Henry.
Yeah.
Henry.
Yes, y'all.
I found your music. You want your music now?
What do you want me?
Let's try your music, okay? And then you tell me if it's too loud or not.
Then he is given an iPod containing, we know, his favorite music. And immediately he lights up. His face assumes expression, his eyes open wide. He starts to sing and to rock and to move his arms, and he's being animated by the music.
And he used to always sit on the unit with his head like this. He didn't really talk to much people. And then when I introduced the music to him, this is his reaction ever since.
The philosopher Kant once called music the quickening art, and Henry is being quickened, he's being brought to life.
Yeah.
I'm going to take the music for 1 second, okay? Just to ask you a few questions. Okay? I'm going to give it back to you.
Uh-huh.
Okay.
The effect of this doesn't stop, because when the headphones are taken off, Henry, normally mute and virtually unable to answer the simplest yes or no questions, is quite voluble.
Henry,
Yeah.
do you like the iPod? Do you like the music you're hearing?
Yes.
Tell me about your music.
Well, I don't have none. I mean,
Do you like music?
yeah, I'm crazy about music. You play beautiful music, beautiful sound, beautiful.
Did you play music when you were? Did you like music when you were young?
Yes, I went to big dances and things.
What was your favorite music when you were young?
Well, I guess, well, Cab Calloway was my #1 band guy I like.
So this was self-explanatory, amazing. And then, when I saw this for the first time, I knew some reactions of patients with aphasia, language problem after stroke, which, you see the same thing where people are not able to communicate, but when it comes to music, it's much easier for them. And the question was, how is that? And there was a beautiful research from Jacobson and colleagues. They, on the left side, they asked people to listen to familiar music. And the areas that are orange in the brain, you see those are the areas that are related to processing of a long-term memory of music. And on the right side, at the bottom, with the colorful pictures, you see areas of the brain that have shrinking or atrophy. Orange would be more shrinking, and green and yellow less. So you see this person with Alzheimer's disease has a lot of atrophy or brain tissue loss. But if you look at the top, in the inside of the frontal region of the brain, you see that area that is red, and then that area is intact. It's not affected by atrophy or shrinking. And that is one of the major areas that actually processes long-term memory of music. And then because of the way the disease progresses in the brain, this area is intact, and then it helps with processing of music, and also, add to that intact cerebellar function. So when I saw this for the first time, I collaborated with the Institute for Therapy Through the Arts by sending patients for music therapy. And then they once asked me to go and see one of their music programs in an assisted living facility, a memory care facility. And I saw an effect that you saw in the previous individuals I showed you, and I was very intrigued. So we talked about collaborating and doing research to see how they benefit from music. This method they were using is called musical bridges to memory. It was developed by a group of people, musicians, music therapists, ORF teachers, and the way it works is the core of it is 30 minutes of large group music performance. And however, before that, they added 30 minutes of caregiver training where, they can facilitate communication between the caregiver, spouse, and the patient. They both sit for the sessions. It's a group intervention, and they try to make music together. These are patients who have moderate to severe dementia. They can't communicate very well with spouses. There's a lot of misunderstanding. There's a lot of frustration. But what happens is when they listen to music together, they are able to communicate in the context of music. They are able to make music together. They give them musical instruments, percussion instruments. They can dance to music. They can sing along. And then the material that the ensemble performs includes all these modalities. And then after the music is over, they sit down and talk about the music, about different things afterwards, which kind of stimulates the brain. So it's an amazing life enrichment activity. And we wanted to know if people participate in these sessions. And then for our purposes, 12 sessions once weekly, what would happen? So this is an ongoing study. We have some results I wanted to show you. But before that, let me show you one of the sessions. You see here the individuals with dementia, their care partners, and people who are walking are music therapists, and you see the ensemble on the left side. And then you can see how on the left side, you'll see when I play the video, how smoothly the music therapist changes place with one of the care partners to help with the process.
From the Nutcracker. This is the Russian dance. This is a fun one to play along with.
All right. So Bob McCopham from Chicago Tribune stopped by once to see one of these sessions, and then he was so intrigued and wrote a beautiful article about it in Chicago Tribune. The effect is just so interesting that everybody is moved by it. And so let me give you a little bit of update on what we've been doing so far. So we've had so far 21 individuals with the actual intervention, and 10 in a control group where they got all the care in the facility minus the musical intervention. And you'll see that before anything is done, it's very important to know what type of music works for people. In a group, it's more challenging because music is very much ingrained in our brain with memories and emotions. So we may have bad memories from a music we heard before. For example, people who went through wars, through Holocaust survivors, they may have sensitivity to certain type of music, certain type of instruments. So it's very important to know that. And then we used what's called the music preference assessment. And the areas that are red, you can see what type of music do you enjoy, different genres, what instruments or instrument sounds do you like, and then what don't you like? What music, what sound, what instrument. So this is very important. And then we try to perform the music that really most of the people liked it and then wouldn't be bothered by it. So this is how the music was picked. And then what we did, a lot of people had looked at, effect of music on anxiety. What really people hadn't looked at was this social engagement. And then we used this tool called verbal nonverbal interaction scale. And it contains two categories of social interaction: sociable behaviors and unsociable behaviors, verbal and nonverbal. So a nonverbal sociable behavior would be just looking and eye contact. A nonverbal unsociable would be looking away, aloof, or staring in the space. A verbal sociable would be coherent communication, and then verbal unsociable would be incomprehensible communication. So we wanted to see if these sessions and that the musical interaction people have with their care partners would help them and their care partners. So just to show you one example of someone before and after, you may have to, again, increase your volumes with this one. This is before.
Yesterday it was probably
You're sleepy. What time was the bake sale?
9:30.
Okay. And what time did you show up?
9:30.
9:30? Okay. Did you buy anything at the bake sale?
And so as you see, the this individual with cognitive impairment is mostly, he was looking away from the wife and not quite engaged in the conversation. But this one is after.
Tell me about your day.
Sessions.
What did you do today?
Oh, I got up and went and saw a baseball game.
You did?
Yeah.
Who was playing?
It was Baltimore and...
Was it a local team?
It's Baltimore and the Cheers.
The Cheers?
So you see that, the eye contacts were more after the intervention.
Tell me about
this
your day.
was one example. When we looked at the rating, and then the rating is one of our PhD students went through all these videos 10 minutes before and 10 minutes after the intervention and rated them minute by minute. And then you see the rate of, so the brighter purple is on the left side, that's the experimental group. They had more sociable behavior, and this was significant when we looked at the difference. And in the control group, as you see, their sociable behavior dropped over time. Unsociable behavior went up in the control group, but went down in the intervention. We didn't reach significance though. It was in the right direction. We still need more patients really to have a better power for the study. Again, for nonverbal behaviors, sociable behaviors went up in the intervention group and went down in the controls. And unsociable behaviors really didn't increase in the control in the intervention group, but significantly increased in the control group. So you do see that there's a difference between the intervention and the control group. When we looked at the neuropsychiatric inventory, which looks at delusions, anxiety, depression, cheerfulness, hallucinations, those all went down. We had a trend there, almost significant in the intervention group, but these symptoms got worse in the control group. We had a very strong response from care partners. They definitely reported that they felt they had less burden as the interaction between them improved during these sessions. And it was the opposite for the control group. So music bridges to the musical bridges to memory administration was associated with significant improvement in sociable interactions and specifically nonverbal. So this is interesting. Music is a nonverbal communication. If they have language difficulties, you need to really address that through a linguistic intervention. So they had the best results for the nonverbal interactions, as you saw in the video I showed you earlier. There was a trend for less disruptive or negative neuropsychiatric symptoms, and there was definitely an improvement in caregiver or less distress for caregivers. The effect is immediate. You can see it right in the session, and they it kind of went beyond, generalized beyond the sessions as well. So we would like to look at, the interaction between inner session and outside the session behaviors. And we want to see if having the music in place would decrease the need for medications for individuals with neuropsychiatric disorders and dementia. That's a very important one because a lot of medications we have now have side effects. We really don't want to use them. If we can use a non-pharmacological intervention, we would like to do that. And it has, if it's done in a correct way, the side effects are much less than medications. So now we got a grant from National Endowment for the Arts, NEA, and then we are continuing this. Unfortunately, we had a huge gap because of the pandemic, because the assisted facilities weren't allowed to put people together in the room and then to involve the music therapist. So we were just waiting for the third round of vaccines and for the numbers to go down to be able to continue this. So I just want to talk to you a little bit about the choice of music and then what we learned really during the COVID pandemic. So we couldn't do this study, continue in person. But COVID created an opportunity to test whether telemusic, music through Zoom or other platforms would help patients. One of the areas that was discussed at Northwestern Music Therapy Conference was music as a psychological first aid. And during the pandemic, we had all these patients who were alone in the neuroscience unit, neurosurgery and neurology. They couldn't have visitors. They were already distressed from their diseases and the diagnostic workup and everything. And we thought, how about we take music to the bedside? So in collaboration with one of my collaborators, Clara Takarabe from Chicago Symphony, who is also a music practitioner, and also Alyssa McFadden, a music therapist, we designed two sorts of interventions. One was based on preferred music, same thing that we used with patients with dementia. And then the other one was in people who were more agitated, we used just improvisatory music. We called it clinically designed improvisatory music, a music that is slow. There's a lot of pauses. The range of pitches are within the human social interaction pitches, which is calming. And then when we piloted it, we saw that on the left side, you see the blood pressure. This is one example of one person. Blood pressure goes down and it stays stable for another 6 hours afterwards. And heart rate goes down during the intervention and continues to go down, and the person stays calm even after the intervention. And this is for a patient who had anxiety, chest tightness, palpitations. Those symptoms also decreased, and this person felt better. So then when we started, again, we got very interesting coverage from the media. Wall Street Journal and NBC Nightly News covered on what we were doing. Patients loved it. They all recommended. The likelihood to recommend was about 95% or 98%. It was they found it very, very helpful. What came out also out of this intervention was the genres people liked, based on their age group. So people who were on the older side, 46 and above, like classical, jazz, and R&B, and people who were on the younger side, like pop and rock. So this is interesting because, you know, we kind of gives us an idea, because the musician had to prepare the music every day. That's a lot of work to do. But if they have an idea of what works, then that can be done very much efficiently. The other thing and then this was all sorts of neurologic diseases, including dementia. What happened also was we had a group of patients who were connected to electroencephalogram, and we could look at their brain waves. And this is very interesting. This is 5 patients that, you know, we happened to have their electroencephalography, and we had permission to look at the EEGs. And you see the maps, the EEG map on the left side here. Areas that are red have a higher frequency. The brain is very engaged. And then as you go down the heat map, yellow, green, and blue, the brain calms down. So calm is blue and working brain is red. So this is right before the intervention started. The intervention was about 25 to 35 minutes. During the first 20 minutes, you see that that cooling of the brain and the slowing of the brain with the calming effect of the music. And then this is for people who, you know, we looked at the videos. They were not quite content, and they were agitated. And then as soon as the music started, it was like taking a bath, a warm bath. And then in the second 20 minutes, you see even more areas on the sides of the brain start slowing down. And what was interesting was when the music stopped, this is 20 minutes after music stopped, in the back and front of the brain, still they don't go back to the previous pre-state. Still they stay calm. And then we have the opportunity to look at the other timeframes as well, then we will. So this really became a project for us to see the same thing in dementia. So we are now trying to raise funds and apply to research grants to look to see what happens in the brain when people with dementia look at improvisatory music. So this was during the improvisatory music. And then this improvisatory music doesn't have much because it's not a familiar music. It doesn't bring back memories. So it's kind of a neutral type music. So that's very nice because we don't have to worry about side effects or poor or distressing memories. So we're trying to learn more about this aspect of intervention. Improvisation has been used in dementia. For example, verbal improv. We had a project with Looking Glass Theater that showed it helps the patient and the caregiver. Instead of relying on short-term memory, they just live the moment. All right, so thank you so much for listening to me, and sorry about the glitches. I just wanted to summarize here. So for the music and the brain part, what I wanted to show you, I hope I showed you that the processing of music goes beyond the auditory cortex, beyond the right or left hemisphere, and includes the whole brain. As for the therapeutic interventions, now we have more efficacious interventions and more research to support it. Still, we need more. And interestingly, now there are more interest in terms of funding through the NIH and other organizations. In terms of music and dementia, music is an effective intervention, both for emotional and psychiatric disorders. It might be effective also for cognitive aspects. We need more research in that area. And then we talked about the familiar versus unfamiliar music and then how they can be used in different situations. Thank you again. These are my collaborators. I have to really thank all the collaborators from Institute for Therapy Through the Arts, Jenny Rook, Jeff Wolf. At the time, I was medical director at one of the locations for Silverado Memory Care, which unfortunately doesn't exist anymore. Also, my research team, very dedicated students and young individuals who helped. Support from our center, Dr. Morhart, Dr. Mislam, and our funding sources. Thank you. My social media information for our lab, for our music and medicine program are here. And if you are interested in supporting us, the link is here with a QR code. And I'm happy to answer questions. Thank you so much.
Thank you so much for a wonderful presentation. We have a number of questions. We'll try to get to as many possible as we can. Could you comment on, is it the music, the melody, the tune that's remembered, or are the lyrics, the words to a song also remembered long-term in patients with dementia?
Good, very good question. It depends on the type of music. If you're talking about an instrumental music, it's really the tune. I mean, it's for example, a symphony, for example, or a sonata, or a dance. They don't have verbal poetry with them, together with them. For the vocal music, of course, the verbal content can be activated in the memory as well. So people start singing. But interestingly, you may see that the verbal is not as strong as the actual music. Some people, they remember the melody so well. My first patient I showed you could whistle very well, but he might not have been able to sing to the same tune. So there's a little bit of difference there. The music and then the sound itself, regardless of memory and regardless of the words, the sound itself, as I showed you with entrainment, it has its own physiologic effect that's very interesting.
Great. Can you speak to the sort of preventative impact of music? Example, do professional musicians have a reduced chance of developing dementia?
Another good question. I'm not sure if we have strong evidence, and I think we really need to dig into this more. We definitely know that education in general is a protective situation for people to compensate for the pathology in Alzheimer's disease. And I would believe music is the same. We know that learning a new language is protective, for example. So I would believe the same would be true for music. There is some research at Northwestern now ongoing for individuals with aphasia, which they found an evidence that people who had music education, they process language better. And then we know that in individuals or musicians, they can hear nuances of language better. They can speak in other languages better without an accent, for example. So yes, there's definitely a generalization. How much it's protective, that's something that we need to do research on.
Great. For or care partners in the audience, or those working with individuals with dementia, is it really important that we play music or that we engage in music making? And can you tease out sort of the beneficial effects of both? Do you gain more benefits through the active portion or just passively listening?
That's a very good question too. So in general, active participation is preferred over just listening, and then listening to live music is preferred to just listening to recorded music. So people who watch a performance, they get more out of it than if just listening to the recording. It doesn't mean that the recording doesn't work. Recording does help as well, but this is in terms of the impact. And then if it involves movement, and then it also depends on what type of effect you want to get. If you want to wake somebody up in the morning, you use more rhythmic music. But if you want to calm them down, you don't want that much actually participation. So you use more meditative music, which has more of a vague and a non-stressed rhythm.
That makes sense. People are wondering about kind of the practical application, and are there locations in the Chicagoland area or resources that you're aware of where people living with dementia might be able to access music sessions?
Yes. So, at Northwestern now, what we are doing is, we are having these series of concerts and conversation called Musical Museum that I think we've done 3 so far, and we're going to do more of them. So if you stay tuned through social media and then in contact with our center, you'll hear about them. So those are mostly, to listen. And then if, we still can't have in-person sessions, it would be very nice if we could have that. So this is mostly a life enrichment activity. For more, therapeutic interventions, I would recommend people would look for music therapists or music practitioners. They are so many of them in Chicago area. Institute for Therapy Through the Arts, I collaborate with them. They are amazing. They have, I always send people to them. I have people who, because of their dementia, can't process vision. So for them, music would be the best. People who can't talk, music would be the best for them too. And if you just look at American Music Therapy Association, I'm sure you can search for people in your areas where you live. And if you have any questions, you can send me a message, and I'm happy to help.
Great. Can you talk about maybe a prescription of a musical intervention? How frequently should someone be listening to music and engaging? What's the intensity, the volume? What type of music in particular should they be listening to? And is there a given dose? You need to listen to at least 30 minutes a day or something of that nature.
Right. So this is, when it gets too specialized, I ask people to consult a music therapist. They are the clinicians and board certified people who are really, who can tell you exactly how much, how many times, what music. From my experience from research and interacting with them, in terms of choice of music, you want to use music that the person likes. As I showed you, we had the whole questionnaire: what genre, what type of music, what type of instruments, and then you can just ask the person and they can tell you. In terms of the actual length of intervention, we really don't want it more than 30 to 40 minutes because music itself can be overwhelming to the senses too. And then in dementia specifically, you have a situation where people can get very overwhelmed if there's so much sensory stimulation. So you kind of have to gauge that. And I think that therapists do that, and then care partners can kind of gauge that too. When it gets to the point that it's not working, that means that you need to really cut that amount. I would like daily interventions if it's not possible, 3 times per week, if not possible weekly. But again, you got to be careful about the sensory overwhelming situations where that's not a good thing. So it's usually good to consult a clinician who's certified as a practitioner or as a therapist.
Great. Well, unfortunately, we're at time and we can't get to every single question. I want to say thank you to everyone for attending. It's been beautiful to read the comments in the chat talking about personal experiences with family members and music and the power and impact that it has in our lives. So again, thank you so much to Dr. Bonakdarpour for sharing your expertise and your information today. This was wonderful. I'd like to make note again, thank you to the Jewish United Fund for supporting our lecture. The lecture is recorded. It will be on the CJE SeniorLife YouTube video, YouTube channel in a few days, so you can check that out there. Save the date in January. Our next presenter will be Dr. Jennifer Goldman, who will be speaking about the Parkinson's disease and the brain. So we're excited to welcome her after the holidays. I hope everyone has a wonderful Thanksgiving. Take care.